Nothing contained in this podcast should be considered a substitute for professional medical advice. This content does not represent our respective employers and is purely the opinion of the podcast hosts. We are not your personal medical providers. Sorry, friends. So, if you have any questions or concerns or seeking advice, diagnosis, and or treatment, please seek individual, personalized advice from a healthcare provider in your area. We are not liable for any risks or issues associated with using or acting upon the information contained in this podcast. This is intended for educational and entertainment purposes only, so enjoy the ride. Welcome to Medical Media Mixer, the perfect cocktail. I'm Nicole Peniston, psychologist.
And I'm Tara Briscoe, physician assistant. All right, so you did a big presentation today. How did it go?
It was fine. It was not that big. I was part of a panel, which originally was supposed to be 3 of us. So it was going to be about a 15, 20-minute presentation. And then last week, one of the presenters had to drop out, so that it was just 2 of us. So I was like, well, I can just riff on the stuff that I have. and it was fine. And then I was nervous about running over because I was going first. So I didn't want to steal too much time from the other person. So then I probably could have talked for an extra 5 minutes and I just didn't. And it was fine. But I was just I was so nervous that I was just going to keep babbling. And then this poor man was just going to sit there and wait. And I even told him before we started, I'm just wave me down if I'm talking too much and it's your turn to go.
So that's me. Like we said, I talk too much on the podcast.
Yes.
We need to just...
I think it was because in the podcast, we're interactive. But,
right.
With
this is just you.
I just had to keep talking. And then the room, we're sitting there, we were getting prepped, our slides were up and everything. And then it was weird because there was this rised up stage, but it was a big step up and there were no steps.
Okay.
To
God, who wants to fall?
And then normally there would be the tables for the presenter at the front. So you're facing the audience, but there was nowhere for us to sit. So we had to sit in the audience and then go up awkwardly. It was a whole weird thing and it was fine. And then I texted you, someone had an ASL interpreter, which I was okay, that's cool. And they give us a heads up for that. And then when I got there, there was opening remarks and a keynote speaker. And I see the ASL interpreter at the next table and she's facing the person she's interpreting for and she's interpreting and he is not even looking at her. He's looking at his phone. He's flipping through the program. He's looking around the room. I'm dude, this woman is working right in front of you. For you, yes. And then it was 2 interpreters because they're with what is it called? When they're interpreting live, in the moment.
Yeah. I don't know.
Tandem interpretation? There's a special word for it. But when they're doing that sort of interpretation, I learned this when I worked in the courts, they can only interpret for a certain amount of time and then they have to switch off. So there were 2 interpreters there. Oh. And so they would about 25 minutes, they'd interpret each and then switch off. And I noticed that when the other interpreter came in, who was a man, he paid more attention to this dude. And I was that's not cool. And then at one point I could tell he wasn't interpreting what they were talking about. They were having a chat conversation in sign. And I'm just
what was that country who had the fake interpreter? There was some country who this guy was literally for the government interpreting. And then people were
doing random signs.
Yeah, that's not real ASL. That or whatever, you know,
That's so funny. No, I believe they were interpreting. And then I realized... because I was, at one point, I was zoning out and staring at them. The lady, when she interpreted, she kept making these weird faces. So she'd be for those who can't see, making duck lips, but also puffing out her cheeks while she's interpreting. And then when the guy was interpreting, he was also lip syncing. So, because I guess the guy could read lips also.
Right.
So he was lip syncing as well as sign, where the lady was just once in a while, she'd say a word. I guess maybe if it's a complicated word to sign, she would, lip sync it. I don't know what to say. But the guy was just not paying attention to her. And then right before my presentation, the person who was moderating it went up to him and was oh, do you want a printout of the notes? We can get that for you. And he was signing and he was basically I'm an attorney. I'm just here to take the information in. I don't get credits for this or anything. I'm just here to hang out. And I'm
okay,
so you're here to hang out and now there's 2 people working directly for you and you're just chilling like a villain.
So one other side note, have you ever seen, this is the best thing to look up online, is for concerts, especially hip hop concerts,
yes,
the interpreters.
When they start dancing.
I just want to watch them. I'm you guys are so much fun.
Yeah, that's got to be the dream job in the interpretation world.
Right?
Well, cool. I guess maybe not everybody likes it. Depends on the music, I guess.
I don't know. It looked like they're having fun.
Yeah.
Oh my goodness. So another dreary, rainy day in Jersey.
Yeah, it took me So the conference was like an hour away from me, and it took me like an hour and a half to get there.
Ugh.
And then the weather just got progressively worse during the day, so I actually skipped the last session, and then I felt bad because I'm like, I would hate if I was scheduled for the last session and everybody's sneaking out because the weather's so bad. But
Yeah.
it is.
Oh, well. All right. Well, today we have some fun stuff. I mean, my part is not as fun, but your part is a lot of fun.
We have sexy stuff to talk about today.
And I had to like cram and watch the last 2 episodes last night. Like I watched the first 4 and then like life got busy and I was like trying to find time. So I was like, must see, end of show.
Well, I don't know if I told you when I started watching the show, which, spoiler alert, we're talking about dying for sex. When I first started the show, for some reason, when I like hit the button for it to start, it started with the last episode. And I didn't realize it until the last episode ended. I'm like, wait, what? She dies in the first episode? And then it was like, oh, it was the last episode.
I don't even know how that happens.
I don't know how it happened either. I must have like hit something, maybe like the forward button or something. And then so I watched it kind of out of order, but I still watched the whole thing.
Yes. So I'll just give the little blurb of it and then you're good at telling the story.
Why don't you tell us about your cocktail first and I'll tell you the line.
So my cocktail is the Slippery Nipple, which is a shot, basically. My layers didn't come out as pretty. If you look at the link I sent, it has this really pretty picture of what it's supposed to look like, and it looks like a boob and a nipple, but mine doesn't. So you're supposed to put a 1/4 ounce of grenadine in the bottom of the shot glass, and then you use the back of a spoon and you pour 3/4 of an ounce of sambuca over that. And then I know, the sambuca. I'm not sure how I feel about it. We're going to see how it goes. And then another 3/4 of an ounce of Bailey's floated on top of that. So hopefully the Bailey's sort of disguises it all. We'll find out. I'll wait to drink.
At the picture, I don't see I understand why it's supposed to look like a boob, but I don't see it.
Yeah. You see the one with the red?
Yeah.
At the top, yeah. Mine is
too
not.
big.
Yeah, mine has a tumor.
Yeah,
right
yours
there.
looks like the brain on fire.
There's like a cloud of something there. I don't know. I'll wait to take it until you do yours. We'll cheers with a drink.
Okay. So my drink is called the BDSM, which, spoiler alert, I'm going to be talking about BDSM. And mine is 45 milliliters of bourbon whiskey, 15 milliliters of strawberry puree. I put in a little bit more than 15. It says 4 units of mint leaves. I just put in 4 mint leaves.
But I don't understand with like sprigs of things how they have units.
Yeah. And then it says 2 fresh lime wedges, and then you top off with soda water. So the link in the show notes, for some reason, doesn't tell you how to make the drink. So I just put it all in a glass with some ice, and I'm going to drink it. So
sounds good.
That's my drink.
Let's cheers, and let's hope the sambuca goes down okay.
Cheers. Enjoy your slippery nipple. She did it, folks. It went down smooth.
Actually, yeah. I think the Bailey's chills the sambuca down. I like licorice, but sambuca is a little much. Yeah. So real licorice, if you've ever had like real licorice, like Iceland has really good like real licorice.
Yeah.
Not like the stuff that you get in like a jelly bean or
not
whatever.
As bitter. Yeah.
Yeah. It's really smooth. This wasn't bad. So just really quick before we get started, since I knew I was doing a shot, I wanted something to sip throughout. So this is iteration 1 of my attempt at making our perfect cocktail. So I'm experimenting. So
2 drinks on a Wednesday night. Good for you.
Well, one's a shot, you know, and it needs something.
We're
whatever.
old.
I'm going to sleep after this anyway. I mean, we're talking about BDSM. I needed to, liquor it up a little bit, loosen up things.
I didn't know you were so buttoned up, so tight. Oh, that wasn't what. No comments.
So I have here, look, in the glass that you gave me, that we had bought. And then so what I'm trying is I did the infusion kit that we had bought online, which was the lemon lavender spritzer. It's the lemon lavender infusion kit and it has some sugar in it too. So you mix that with the vodka and you steeped it. And then I forgot about it for longer than the amount of days. And then I strained it and it's just been sitting in my cabinet. So I pulled it out and I believe it was 2 ounces of that to 1/2 ounce of elderflower liqueur, the Saint Germain, and then a squeeze of 1/2 a lemon, and I shook it in a shaker with ice. So it didn't make a lot, I guess, or these glasses are particularly big. So let me see how it goes. It's pretty good.
Nice.
I feel like we need to tweak and craft, but I was doing some little sampling. I can't make it purple. I tried.
That's okay.
The things I have to make it purple didn't taste good.
Purple food coloring. I have creme de violet. That might make it purple.
True. True. I haven't tried that yet. All right. So I'll give the blurb about what the show is. Dying for Sex is an American comedy drama miniseries based loosely on the real life experiences of Molly Kochan. It's written by Liz Merriweather and Kim Rosenstock. And the show basically talks about her being diagnosed with terminal cancer, leaving her husband in the search of an orgasm. And the show has a really good cast. I mean, Michelle Williams is the starring role. She is absolutely amazing.
It's phenomenal. I never really super strong feelings. I didn't dislike her, and if she was in something, I was like, oh, okay, she's cool. I did like her in The Greatest Showman, but in this, the entire time, I was like, she needs to win some sort of television award for this because she was remarkable.
Really, there's just such nuance to her character. I loved it. I think of her from Dawson's Creek, of course.
I was never a big Dawson's fan.
Oh, really? Yeah. And then, there's the character that plays her best friend is played by Jenny Slate. Then Rob Delaney plays the neighbor.
Mm-hmm.
A couple other people. Sissy Spacek plays her mother, which is always fun. Basically, the show was released in April of 2025 on Hulu and Disney Plus, and apparently it made the top 10 most streamed series in the U.S. from March 31st to April 6th. So in that first week, and has had good critical reception. Some people questioned its length and volume of sex scenes. I found they were done very appropriately for the story. I found they were very well done.
I was honestly expecting more with Dying for Sex being in the title.
Yeah.
I think it was appropriate. I mean, okay, let's put it in context. Appropriate for Disney. It was a lot of sex for Disney.
Well, it's Disney Plus because they own Hulu. It's not really.
No, I know, but
Disney.
still, for it to be produced by a Disney company,
right.
Definitely a little bit more risque than they've been known to do in the past. But I thought it was appropriate, and I actually, when I was doing my research, I found out that the journey of Molly in her sexcapades, shall we call it, was actually much, much longer and more in-depth than they covered in the show.
Right. And there's a podcast, which I found out in the credits, and I want to listen to it, but I haven't had time. But it's not that many episodes, so that's doable for sure.
Yeah. So shall I take it away?
Tell us the story.
So the story is Molly is in an unhappy marriage. It doesn't seem like it's necessarily over the top unhappy. She just feels unfulfilled. She kind of is stuck in the rut and going from day to day and just going through the slog. And then as we go through the first episode, we see that they're in couples therapy, and she receives a phone call saying that essentially they were alluding to her. She had some pain in her hip. She went to the doctor. They took a biopsy, and they found out that she had stage 4 metastatic breast cancer that had infiltrated her bones. So then through a series of kind of flashbacks throughout the episode, you find out about her, how she was originally diagnosed or not diagnosed with breast cancer. And
she was diagnosed and treated. This is a recurrence.
Right. No, I'm saying there's
in the very beginning when she was written off by that jerky
later
doctor.
on we find out there was a particular doctor she went to who kind of blew off her concerns. So there's a lot of,
because she was too young or whatever.
There was a lot of anger and resentment towards that doctor. And then so she finds this out in this phone call, and she just up and leaves a therapy session. She's just like, whatevs. So she goes and she leaves, and she goes to a local bodega, and she gets some soda and some cigarettes, and she just sits down, and you can kind of tell, they don't go into detail, but she's like, well, screw this healthy living. If this is it, I'm just going to enjoy myself, even though it's dollar store soda that tastes terrible and, not the greatest cigarettes. But she's like, why am I going through all this if this is what's going to happen? So then she calls her best friend, who that is when we first meet Nikki, who really gets overwhelmed by the news that her best friend essentially is dying. And so then later on, Molly goes home, and she's trying to get her husband into having sex with her, trying to get his mind off of all this stuff. And it kind of all breaks down, and they don't end up having sex. And then Molly's really, at that point, that's when she's starting to rethink her life. If the rest of my life is limited, what do I want? What do I need? And she's really kind of unhappy with the intimacy level in her marriage. There's a lot of other relationship issues that are going on as well. So then she goes to the hospital for her treatments and things like that. And she gets matched up with a counselor to help her through this process. And she confesses to the counselor that what she wants to put on her bucket list, which is proposed, is to have an orgasm, because she shares that she's never had an orgasm with another partner, that she's only done that through her own personal stimulation. And so that's kind of of how she begins this journey on trying to have sex. Throughout this, she signs up to a dating app. She finds out that some of the complications of her treatments can be reduced libido, induced menopause. She has a lot of shame about her mastectomy scars. And so there's a lot of body image issues going on throughout this. And then she's trying to figure out like what she wants to do with her life, how she wants to be happy. And so she ends up going on a little journey of sexual exploration and gratification, essentially, until unfortunately she ultimately does pass away. There's a really sweet engagement with her neighbor, who initially she ends up really hating and taking a lot of her anger out on him. And then eventually they do become romantically entwined. And it's very, very sweet because he kind of just meets her where she's at and is like not questioning, like he wants to get to know her. It's not just about sex. It does start off that way, but he really cares for her and wants to be with her and help her satisfy that bucket list goal of having her first orgasm, which he does. He is able to do that.
Yeah, I like the way that they sort of portrayed that, the development of that, where it started out with her with the, BDSM sort of, being a dominatrix type thing. But in the end, he's warming up to her and she's still very guarded. And it took her kind of taking, her walls down. But that second to last episode in the hospital with him and her, that whole episode was just done so well.
Yeah, and it was just so touching. So the episode that Tara's referring to is, at this point, Molly is now on hospice. She's really not doing well. She's in the hospital, and he finds out. She tries to keep stuff from him, but he does find out, she's really, really not doing well. And so they have like a little like sexy date night in the hospital. They talk the nurses into like letting them have a little bit of time alone, and he's just so supportive of her journey and like wanting to make her just have a really positive experience, both with herself and her body, but with him, and just to forget about all this other crap that's going on, forget for a couple of hours that she's dying or that she's in pain and just enjoy herself physically and enjoy the moment. And it's so sweet.
Right. Also, a little shout out to that counselor, the palliative care counselor, Sonia. I love the character. I like how she drew, her out of her shell and sort of, I think she got attached as well to Molly, like I think in the end, right?
Yes, definitely. And then Nurse Amy.
Oh gosh.
Is in the last two episodes. She is the hospice nurse who she does this really, really beautiful scene about how she describes the dying process, and in both the clinical terms, but also in a way that can help someone accept what's happening, understand, just they're not so scared. It doesn't feel so foreign, but she's just super pumped about it. And that sort of energy just makes Molly crack up and like not be so scared anymore. She's like, look, if Amy is like super jazzed about death and she sees this all the time and it's not getting her down, like I need some of that energy. I think she's like, you're a fucking weirdo, Amy, but I love you.
Yeah, I mean, the show, everybody go watch it. Like, we don't want to give you every little detail because it's such a journey, but I really, really enjoyed it.
Yeah, and then just knowing after having watched it that it was based on a true story, that this was really what someone went through and how as scary it can be to have stage 4 cancer, be losing so much control over your life, that you can still have those really beautiful moments of joy with your best friend, with your mom, with the weird dude next door that you kind of like. It's just, it makes it really a really beautiful way to see someone have to go through the end of their life.
Yeah. I mean, the big thing that you're going to talk about is also how they portrayed sort of a very open and accessible understanding of dominance and submission.
And where that comes from and why.
And they even, when she went to that party, I feel like the way they showed it, and it was portrayed as a very safe environment. It was I feel like it made it more accessible to people who are like, ugh, that's weird. I think it would open some people's eyes into it. I think it was an interesting portrayal. I think they really did a nice job with that.
Yeah. So you want me to just jump into that stuff?
Sure.
Okay. So as we were just talking about, at some point in her journey, the counselor kind of hints to Molly that if she wants to explore her sexuality, that she's going to the sex party. And we find out that for the counselor is probably loosely based on a real counselor, or maybe just made up for fiction. Either way, it's a great character. But she and her former partner were involved in a lot of this sexual exploration world. Her partner was more into the BDSM part of it. It sounds like she was definitely straddling the fence with that, but then also just involved in more general sexual exploration. And so she invited invites Molly and Nikki to come to this party, and they go in and they like joke that they're like dressed as like their 19-year-old selves, like dressed like slutty and like, you know, like little lacy tops and like thigh highs and stuff like that. And so they go into this party and there's literally like probably like 50, 60 people there who you'd probably just be normal people you'd pass on the street, but they are definitely more open about their sexuality and their bodies. And so you see in each kind of room, it's structured for some sort of play.
Different kink.
Or observation. Yeah, some sort of kink. There's different types of rooms. And so Molly and Nikki stumble into the room that Sonia's partner is running, which is a BDSM room, but in that room, it's not what most lay people think of BDSM as like beating someone up and being very cruel and masochistic. It's more like, okay, I'm going to take control here, but the person that I am doing this to is always in control. It's always up to them. And so, for example, this person is laid out on a table and I believe they're blindfolded. I'm confusing that scene with a later scene, but this woman, I keep forgetting her name, but Sonia's partner, she's just like touching her lightly with her fingertips. And then I think at one point she's using like a feather or something like that. And then the person on the table, even though they are tied down and they're blindfolded, they're the one who says, yes, do this, or no, do this. And there's always this back and forth consensual relationship, which is really what a true BDSM relationship should be. There should be very clear boundaries, very clear communication at every point during the interaction. And then so that way both people are getting what they enjoy out of it. And when I was doing my research for this, I found, and I had heard this before, so it made sense to see it, that a lot of people who have experienced sexual traumas at some point come into this world to regain their power and their control over their bodies and over the sexual act. And we do find out at some point in the episode that Molly did have a history of sexual abuse from quite a young age. I believe they said when she was in the 4th grade or 3rd grade, very,
somewhere
very
around
young.
there. Yeah.
And so that was her first sexual experience. So that kind of puts it all together about why maybe that's part of why she hasn't been able to have an orgasm with another person, because of that initial violation of trust, feeling of loss of control, maybe some shame about her body, which we also know that later comes in with her mastectomy scars and her other injuries and the way that her body is responding to treatment. She has a lot of body shame about that. So after that initial foray into the party, it seems like Molly gets a little bit spooked, but she's not like totally not into it. She's just like, I don't know if this is for me. I don't want to try it. And then she has that encounter with her neighbor who she does not like. And she basically like yells at him and can pick up that like he likes it. He likes being yelled at. So she just like goes for it and she's yelling at him or whatever. And then they end up in his apartment and they're, it's this mix of like this sexual heat and tension, but also anger and a little bit of shame on his part. And then at one point she kind of gets really frustrated and it seems like it's not meant to be in a sexual way on her end. She kicks him in the crotch, but then she falls and she actually ends up fracturing her femur in the process. And so that's kind of how he starts to learn that she has something else going on, because he's like, yeah, you fell over, but like you shouldn't have like broke your hip from that. Like, that's not common. So then later on, as Molly is still exploring herself sexually through these apps, really not finding the true connection, once in a while still engaging with the neighbor, but not to the same extent, she meets again with Sonia's ex-partner, who works at like an IKEA or like a mattress store or something.
Right. Yeah. Furniture store.
Yeah. And then they go in the back room and basically the partner ties her down and essentially walks her through maybe a BDSM light version. So nothing like truly sexual happens in that scene, but it's very, very intimate. And I like the way that they kind of show that intimacy and sexual acts don't have to be the same thing, but they can both be just as satisfying. And so in that scene, the partner is essentially telling Molly, like, you tell me what to do. And so Molly's like, okay, tie my hands, but don't do it this way. And yes, you can touch me here, but don't touch me there. And yes, you can do this, but don't do that. And that's essentially all that happens in that scene. But by the end of the scene, Molly just has this new power over her body, over being able to voice what she wants and what she doesn't want. And I love that that translates into her next doctor appointment. So I don't know if you remember that scene.
I love the way the doctor grows throughout this too.
Yeah.
I love how she influences each of these people's lives.
Yeah, she does. So essentially she goes to this doctor's appointment with a doctor she's had for some time. And he's, not a bad guy, but he's very traditional, old school white male doctor, where he comes in, he's like, okay, young lady, we're going to do this. And this is what we're going to do. And so I don't know if it's in that scene, but at some scene she says to him, like, call me by my name, like, call me who I am, talk to me, don't talk about me. And so he definitely like he listens to that and he pivots very quickly. But in this particular scene, you know, she's sitting on the table and he comes in and he's like, well, we're going to do this. We're going to do this. We're going to do this. And she said, stop. Come sit down next to me. And I want you to tell me what my choices are. I want you to tell me what my options are. And then I'll make a decision. And so he's kind of weirded out, but he does. He goes and he sits down next to her. And I think it's so sweet. At one point she says, can I touch your hand? And like, so she holds his hand while he talks to her because she can see that he's nervous. So she's trying to like stay in control, but also comfort him, give him what he needs in that same sort of BDSM personality dynamic. But this was clearly not a sexual situation. And in that one scene, she just kind of gains power over her treatment simply by asking, simply by saying to the doctor, treat me like a person, tell me what my options are, let me make the choice and respect my choice. And she does end up doing what the doctor wants her to do. So I think that's really important for a lot of professionals out there who are watching it is patients aren't always going to say, no, I don't want to do what you want to say, but they want that choice. They want the option to say no. And a lot of times, especially in that sort of care, I don't think patients are given that many options. So I got a couple articles I'm going to link in the show notes, but there is one where the writers talk about some of the hesitation they had about bringing in the BDSM world, doing their own research about it, talking about the different experiences and how to make that portrayal more about being powerful, being in the moment, and it being more about sensation versus sex versus orgasm, which it does eventually lead to that. But that's all part of the process is feeling in control and really paying attention to where your body is and what it's doing. And what I think is really powerful about that is when someone's going through these extensive treatments, they may not have the same sensations or feelings in their body. So getting to explore that and getting to feel who they are now in the moment versus who maybe they used to be or who they would like to be. And so it was they describe it as a loving, careful, thoughtful BDSM scene that they were really purposeful about in the way that they were playing it out every time that it was portrayed. And then also kind of normalizing it, that BDSM is considered, you know, a kink. There's a lot of people who have judgments about it or who are not aware of it. But if it's being done as per how that community supports it, it is a very beautiful and supportive situation. And a lot of people find a lot of healing from that. And so instead of calling it abnormal or saying, you know, it's not normal sex, there is no such thing as normal sex. You know, sex is when you are with someone that you trust and that you care about and you feel safe with, and both getting pleasure in whatever way that may be. So that was really what the writers were looking into. And then the other part that they talk a little bit about is how that comes in as part of the therapy, both kind of spontaneously, like we were talking about before, of putting that power over into her care with the doctor, but then also the relationship with the neighbor. It's been alluded to throughout the series that maybe Molly didn't always have power in relationships, even in the relationship with her husband, which seemed like, you know, it wasn't abusive, it wasn't taking advantage, but she didn't really have a voice in that relationship either. And so this part of this too was about her finding her power, finding her voice in the relationship with her neighbor and being heard, because I think that was explicitly portrayed in the relationship with her ex-husband, was that she was saying a lot of things and he just wasn't ready to hear it. He had his mindset on, you're going to do this treatment, you're going to get better, we're going to do this. Right. And when she had questions or wanted to talk things through, he couldn't hear that from her. In his stage of grief over, you know, losing his wife, both from divorce, but then also from illness, he wasn't ready to hear what she needed to say. And so that was, I think, a big reason why that marriage didn't work, because they weren't communicating. I don't think it had much to do with all this other stuff. But at the end of the day, if you're dying, you want somebody to hear what you have to say. You know, You don't want to waste time anymore.
Right, you don't have it, so.
Yeah, you don't have the time. And then I think part of it too, that they don't talk a ton about in the episodes, I think it's more alluded to, is just wanting to have pleasure and agency over a body that is failing you. I think that's really, really important, especially in things like when we're talking about gynecological cancers, breast cancer, that is so tied with women to our sexuality and to how we feel as women, being able to still feel feminine, still feel pleasure, still feel what we want to feel, even though our body may no longer be what we would like it to be. There's a lot of links, more going deeper into the BDSM world, but I was really just kind of covering what the show covers because I think they did it so well.
They did.
I really wanted to give it justice of what the show did, because I can't really, it's definitely not, you know, your 50 Shades type of BDSM. It's not, you know, these things that people have these misconceptions about. It was showing the more supportive, loving side of it. So I think that was really important.
Yeah, I was pretty surprised by how much, I learned from watching it. I thought it was really portrayed well. As far as like the way they portrayed the medical end of things, for the most part, it was pretty accurate, pretty straightforward. The only things I would say are slightly off is when she did have that deep vein thrombosis in her leg, when her leg swelled up. They don't keep you for a few weeks in the hospital for that. Maybe like many, many moons ago. Nowadays, they put you on a blood thinner and send you home. Unless it's in your lung and you require a procedure, they don't keep you in the hospital for a few weeks.
But do you think it was because of more of the stage of where her cancer was in combination with that?
There's no insurance that's going to pay for you to stay there. I promise you.
Yeah, well, and they never talk about that. Like, who's
They
paying
don't talk
for all
about
this
costs or
treatment?
insurance. Yeah. I don't think that in this world we all have a counselor who's that involved. Like they're
Or a counselor at all. I think a lot of hospitals don't have that on staff, don't have it available.
The other thing I noticed was that they had her awake on the ventilator, which for the most part, those people are sedated. You may wake them up before you extubate them to explain what's going to happen, but you don't have somebody for like days or whatever it was awake on a ventilator. That's very distressing.
Well, and I think that was really important too, because I've seen it actually recently in the news about someone saying that they were like medically handcuffed. And it was like, okay, but like, was it explained to them why you're restrained? Like, is it cool? No, but
No.
there are actual reasons to be having someone who is restrained when you're on a ventilator.
Right. But I mean, like I said, for the most part, it was very accurate, very well done. We'll just do a quick review of breast cancer. We know most of us what it is. So it's a malignant tumor in the breast tissue. There are a couple different types. It is the most common life-threatening cancer in women. 30% of new cancers in U.S. women are breast cancer. So that's pretty big. Median age of diagnosis is 62. So Molly was in, I believe, her 30s, at least the first time around. Yeah. And so she was the outlier. So she would not have fallen under screening guidelines. She would have been under symptoms and diagnosis, but not a screening. Screening guidelines start at 40, and we'll talk about that briefly as well.
And is that indicative of prognosis, the earlier that it starts to show symptoms?
Yeah, because often, like again, you're not under that screening umbrella, so you haven't caught it early. You're catching it once you have a symptom. And it does disproportionately affect Black women in terms of mortality, not in terms of incidence, but just mortality.
And that's probably some of the disparities in healthcare.
Well, exactly. That's exactly what that's about. So do we know what to look for symptoms of breast cancer? Do you know anything that we had to look for?
So I know my gynecologist always tells me about doing the breast exam and the circular movements and supposed to be checking, I think it's once a week in the shower, maybe more often than that.
Yeah. I mean, so those guidelines have changed over time. Technically, we don't rely on self-breast exam because self-breast exam is not super accurate and hasn't been shown to actually change diagnosis. Mm-hmm. But if you do see something different about your body that so you see a change in the size, the shape, skin changes, dimpling. If you looked in the mirror and you see a wrinkle or a dimple that doesn't match up, that wasn't there. And there's this one particular skin change that you can see, which it's not super common, but we always learn about in the books. And it's a French word, so you like that. Peau d'orange. So it looks like the skin of an orange. Yeah. So if you can picture how the skin of an orange has all those little tiny dots in it, if you pictured a breast or part of a breast looking like that, that's not good. There's something underneath, a mass-like, causing that skin to look like that. Any nipple changes like discharge or scaling and a lump in your underarm would also be a concern. And at that point, you'd see a provider and you'd go for diagnostic testing. So that would typically be a mammogram and an ultrasound, and then possibly an MRI or a biopsy. Biopsies now can be done in the radiology place right there, usually with a marker, and usually either an ultrasound or a mammogram to guide them to get right to the spot that they see and biopsy it right there. Couple types of cancer. There's a lot of them, a lot of details. We're just going to tell you the names. Invasive cancers. So it would be ductal carcinoma in IDC, which is the most common. And then invasive lobular carcinoma. And then there are non-invasive cancers called DCIS, ductal carcinoma in situ. There are different types. We're not going to go into every detail, but you may have you ever heard of someone said like triple negative breast cancer? Mm-hmm. Right. So that's talking about those markers. So when they do a biopsy and they take that tissue, they run it through to see if it is estrogen, progesterone, and HER2 responsive. So if a cancer is responsive to estrogen blockers can be used as part of their treatment. Same thing for progesterone. The HER2, also there are medications and things that can be tailored to that. So if you're triple negative, it means that it's not responsive to hormone blockers, which makes your treatment a lot more difficult. And your prognosis a lot worse. As far as treatments, we've all heard of a mastectomy that's taking the whole breast, but often you'll have a lumpectomy, which just takes the piece with the cancer. Sometimes while they're there, then they'll do what's called a sentinel node biopsy, where they take one lymph node from the underarm while you're in surgery. They take it, they freeze it, they look at it under a microscope. If that has cancer positive, then they continue to take more lymph nodes. If it's negative, they do not have to. So that's actually nice because it can preserve some of those lymph nodes from being removed, but sometimes they all do need to be removed, and that would be called an axillary dissection. Some people require radiation, some people require chemo. Those are all very dependent on what their staging is, what their type of cancer, what the hormone receptor positive. Like there's a whole obvious science to that, and that's going to be tailored to you based on what you have. So that is if you felt a lump and you came in for diagnosis or something was found on mammogram. We really want to look at screening. So screening is finding something before their symptoms, right? So that's when we do something like a colonoscopy or your pap smear or anything like that. Guidelines vary. So there are multiple organizations with different guidelines on this. Most of the early guidelines are the same, but as you get older, they change. So the new thing is sort of, if you're over 65, you don't need to do it anymore. But I know 65-year-olds who are very healthy and full of life and have.
Right. I was going to say age expectancy is much longer than that. So you don't want to have breast cancer when you're 70, and before that could have had, 20 more years of life.
Exactly. So, some of the guidelines do specifically say if you have more than a 10-year life expectancy to continue to screen. Mm-hmm. My conversation with patients who get to a certain age is if you're going to do something about it, we keep screening. If you tell me I'm not going to do anything if they find it, then we don't keep screening. But I always talk about the importance of finding something before symptoms, because unfortunately, if we wait, the prognosis is so much worse because it typically has spread, further. So we start mammograms typically in an average risk woman at 40, and some will say annual, some will say biennial. Mm-hmm. After age 55, but typically between 40 and 55, you're doing annual mammograms. And high-risk women will have a different set of screening guidelines. So high risk, we'll touch on briefly. It has to do with your risk factors. Let's just really quick talk about how a mammogram is reported, and then we'll get to risk factors, and that'll be it. So when I get a report from a mammogram, the radiologist will rate it in a BI-RADS, is what they call a BI-RADS classification. So 0 is needs more imaging, 1 to 2 is usually benign looking, 3 is probably benign, but let's bring her back in 6 months. 4 is suspicious. We need to do a biopsy. And then 5 is like, this is 100% cancer. Like, don't stop it. Go to a breast surgeon. And then, you may see sometimes now them rating, well, now I think they do, at least by law, have to rate your density on your report as well. Mm-hmm. Do you know about breast density? Have you heard about it?
I do. I've had to have a repeat mammogram because it said that I had dense breast, but it was the only mammogram that came up that way. And I had a mammogram since, and it didn't come up that way. So I don't know.
Yeah. I mean, so that can actually vary based on your weight and different things in life. Mm. So what happens is breast tissue is sort of whitish on a mammogram. If you picture a mammogram, it's like an x-ray, and it's whitish. And fatty tissue is black. And so the fattier your breasts are, sort of this more spread out that white tissue is, and it's easier to identify something abnormal because that will be white. But if you have very dense breasts, you have a lot more white. And so we say it's like looking for a snowman in a snowstorm. It's like white on white. Well, I can't find it. So if you have a category C or D density, so they do A, B, C, D, C or D density, typically they will suggest that you can also get an ultrasound done at the same time, because that can further characterize anything and just make sure you're not missing anything. So if you hear that, don't worry about it. But that's why we do that, because we need two different modalities to look at it. And it doesn't mean that you have dense breasts, you don't get a mammo. It means you get both. So, because some people are trying to tell me like, no, I just need ultrasound. I'm like, no, you need both. So risk factors, we all know family history is certainly can be a risk factor. But just because you have no family history does not mean you're at risk. You should still do screening. But the way we sort of classify somebody as a high risk, there's a couple different scoring things. There's one called the let me find the name of it now. The Tyrer. Let me find the exact name.
I just took that risk screener
Yes.
while you were talking.
The Tyrer-Cuzick model is the main one that I see used, and that will give you what your risk is for breast cancer. So typical things that can increase your risk would be just having an age more than 50, having genetic mutations, so the BRCA1 or 2, having had your first menstrual period at a younger age, and then having late menopause. So the more periods you have in your life, the more at risk you are. So if you're a late starter and an early menopauser, you actually have less periods in your life. You have a little bit less risk. Also, having more pregnancies is a good thing. So less pregnancies or being nulliparous because you haven't stopped your period for those 9 months.
Being noviparous?
Nulliparous. Yeah. So those are some, risk factors would be nulliparous, personal family history, dense breast tissue. Alcohol use actually can be a risk factor.
Obesity, alcohol use is a risk factor for everything.
For every cancer, yes. Obesity after menopause, but not before. I'm not sure where or why, but okay.
Maybe it's a hormonal thing.
And also lack of breastfeeding. So breastfeeding is also protective because it also delays your cycles. So that's kind of the answer is the more cycles you have in a life, the more time those hormones could influence things and it could change. So, that there's definitely a link to that risk factor model. So I encourage everybody to take it. Often the questionnaires when you go for your mammo, that's basically what they're doing. You check all those little boxes or you do an online one and they're calculating your risk. So enhanced screening would be for people who have more than a 20 to 25% lifetime risk. So you would do one of those things. If you have a higher risk, you would do enhanced screening. And so they would often then alternate mammogram and then MRI, breast MRI every 6 months. So mammogram would still be yearly, but 6 months later you get an MRI and then you get a mammogram and then you get an MRI. And basically that's how it goes. And that's just to hopefully find something before it becomes anything. And I've had some patients who've really found things very early and have had amazing outcomes. Unfortunately, when I find patients who didn't do anything or refused mammo for many years, it's really sad. So go out, get your boobies checked.
Well, just getting our annual screenings, both for breast cancer, our mammograms, doing breast exams, getting our regular gynecological checks, it's going to promote health one way or the other. Even if you don't have cancer, the more that you're on top of these annual exams, the better your outcome is going to be.
Yeah. Get your colonoscopy or your Cologuard. Yeah. All those things.
So
all those fun things.
Luckily, I think I have 2 more years before I have to, no, 1 more year before I have to go for my next colonoscopy. Sadly, I have to go every 3 years.
Yeah, I'm on now, I think, in every 2 or 3 year. I haven't told the pod, I don't think I've told them, but I have Crohn's disease, so that it does enhance your colon cancer risk. So you're not just doing disease monitoring, but after you've been diagnosed for more than, I believe, 5 years, then you need to start going every 2 to 3. Even if you're in remission from your Crohn's, you need to have enhanced colon cancer screening. Yeah. So, but go and get it checked.
Yeah, get all of your things checked.
But do be, let's lighten this back up. I feel like I brought it down. Do research the BDSM that Nicole posted about.
And I realized I totally forgot to say what BDSM stands for. So it is bondage, dominance, sadism.
I think people are scared by the sadism. Like, I think they misunderstand, I guess, the idea.
And it's all in the definition. So bondage, that is being tied up, being gagged. But this is voluntary. This is something that you are asking. It is not someone doing it against your will. Dominance is someone being in control over you. So this is where I'm confused because I know sadism is more aggression during sexual acts, but then I know that submission is also part of it. So now I'm questioning if I'm doing the right S. But because
sadomasochism is the word, but I think it's an outdated term. Okay. I think that's basically what it is.
Well, I'm just thinking of sub and dom. So those are 2 things. And then masochism is. Oh wait, I'm sorry. So I'm confusing it.
Masochism is wanting
to have pain.
Someone dominate you.
No, because dominance is different. It's regarding pain.
Pain. Okay.
Yes.
You're a masochist. You're somebody. Yes. Yeah.
So that's what it is. It's not as scary as it seems, but obviously if this is something that you're interested in, make sure that you are with a partner that you trust, that listens to you, communicate before you do that. And then, go crazy, kids. Have fun. Enjoy your life. We only get one.
And I tell you, watch this series. It was pretty eye-opening. And at the end, I'm like tearing up. And it was just...
I know, the thing when she was like, please don't let me die with my mouth open. And she's like, but don't bite me. And she's like, I won't bite you. I don't know.
I love how the humor in the real life was mixed in. I just thought it was so genuine and it was just done so well. So go Michelle Williams. I agree. I didn't have any positive or negative about her.
Jenny Slate was amazing too. I love her. She's always so funny, but this was the mix of her, funny outgoingness, but also just like really thoughtful. The relationship dynamic she has with her partner is very sweet.
No, it was just a really, really well done. I just enjoyed it thoroughly. It was one of those things that like I'll watch it upstairs in the bedroom and then I hear a kid coming down the hall and I have to pause it, but I can't be like a sex scene on the TV when I pause it. If they open my bedroom door, and I was telling my daughter, I'm like, you gotta knock before you open the door.
Yes. And how could I forget the one scene that like had me cracking up? The guy who enjoyed being treated like a dog.
Oh my God.
And so there's this one scene where Michelle Williams, she's getting her chemo. She's in the hospital. Her family comes in and she doesn't want them there.
Yep. And
they're kind of invading her space. So she texts this guy that she's been having a little fling with on the side. And she knows he enjoys being treated as a dog. And so she invites him to come to the hospital and he legit comes in like on all fours and like barking and like
his dog costume.
Totally scares her family away. It's the cutest thing ever.
Yeah, he's an interesting character. I feel like I know that actor too.
Yes, he's been in stuff before.
But his face is familiar.
Yeah.
I know it sounds crazy, all the things we're saying about this show, but it's excellent.
It's beautifully really done. It's about more than just sex. So I'm glad that, and it's about more than just death. It's about life.
It's true. It's not like, yes, like there is a sad, of course, like moments, but yeah, it wasn't like a downer the whole time. Like it was
a lot of comedy in there, a lot of awkward, hilarious moments.
Yeah, definitely. And some really good character development. They really like kind of changed. Like I said, the doctor by the end, like he was adorable.
And he's been in a million things. He's always the doctor or the principal or the dad.
Yes. And he's like so stereotypical, like that doctor. Like you've met him before in real life. Like that character.
Yeah. But yeah, just an amazing cast, an amazing show. I think everyone should watch it. If it doesn't win any awards, we are going to stage a revolt against someone. I don't know who, but it was phenomenal.
Yes, and I have to listen to the podcast now so that I can come full circle.
I'm glad you said that. We do have to give credit to the original Molly, who is no longer with us, and her friend who documented this whole journey and has brought all of this awareness and understanding to all of us about how dying and death is tragic and upsetting, but it can have levity and pleasure and all this other beautiful parts to it. So
yeah, piece of life, part of life.
Yes.
So, all the people out there, thank you for listening. We appreciate you.
Yes, and we should give everyone a heads up. So, we're doing a little bit of a format change moving forward. So, some of the feedback we've gotten is that our episodes can run a little long. This one we did pretty good with.
We did. I'm surprised.
Yes. But moving forward, we're just going to do one story per episode. So, we'll trade off. I believe I'm going to go next.
Yes, because you had more episodes planned already. Yes. I had to finish my research.
I had a little energy spurt and planned a bunch of stuff. So we're just going to go down to one story each episode, and hopefully that will get people back into it. And please send us your ideas, suggestions, comments, questions. We did get an email from Mr. Seth Burkholder. No, not an email. He commented on YouTube.
Okay.
Yes.
Nobody comments on YouTube.
So shout out to Seth. Thank you for supporting us. We adore you. And hopefully other people will give us shout outs or encouragement and keep listening. And I know, Tara, you've been working on some other fun things for us. So why don't you?
What do you mean? I sent you like a 10-point email.
She sent me this long ass email. And then right before we signed on to record, she sent me like 5 documents. And I'm girl, I am not there yet.
I'm having meetings with ChatGPT.
Well, when I come back from my vacation, then I can join those meetings, but right now I'm not there.
No, those emails are just docs. You can just access those docs. That's all it is. It's telling you that there's docs available that you could look at. Yes, we want to start partnering with people. We want to get ourselves out there. I think it's just about getting ourselves known. I think what we're doing is a lot of fun. I think we just need to, get it out there. So I'm just trying to work hard. I passed out our business cards at the conference today. I've been giving them out to a lot of people. A lot of people seem really interested in it. So hopefully that's going to grow our listenership. I need to learn how to sell ourselves in person. Like I tell random people and like stuff, but I'm not good at like selling myself.
Girl, I can't find someone on a dating app because I don't know how to sell myself. How am I going to sell this?
I don't know. You're more outgoing. I did tell a few
Maybe my future husband is one of our listeners, and then we'll have a lovely story. But for now,
absolutely.
No one.
If you fall in love with that sultry voice right there, I mean, come on.
Yes. Hello, everyone.
And she knows about BDSM, okay?
I know about a lot of things. I don't know, or maybe my next career would just be ASMR type stuff.
You have the voice for it. I hated my voice, but I don't mind it on the podcast. I was happily surprised after our first recording. I'm like, okay, I don't hate my voice.
Everyone hates their voice. I don't like my voice, but I've done voice work before. I've had people comment on my voice. So I know other people enjoy it, so good for them.
All right. So hit up the socials. You know where to find us. Yes. All of them. Instagram, Facebook, YouTube. Pinterest.
So it's still my favorite.
TikTok. Hit us up there. Send us an email. medicalmediamixer@gmail.com. Tell a friend. Tell 10 friends.
Yes, and feel free to leave comments on our socials or on our YouTube or anything.
Interact.
If you don't feel like leaving us an email, at least like the post or shoot us a comment or give a thumbs down if you feel like we need to work on an episode. We will take any and all feedback.
We do. All right. So thank you for listening to Medical Media Mixer.
The perfect cocktail. Cheers.
Cheers.
Your glass is empty.
It is.